Welcome to Module 2. We're going to be talking about the fundamentals of HIV and AIDS. So in this module, we're intentionally slowing down the pace. This is not just some surface level overview. This is where we are building foundational understanding that you can really confidently rely on in your counseling work. So clients come into treatment carrying some gaps, and it's a lot of emotional weight for them. We're going to hear fear and shame and misinformation or even denial when HIV comes up. And that means how you understand and explain HIV is going to matter just as much as what you know. So this module here is designed to help you speak about HIV calmly and confidently, to correct any misinformation without shaming anyone, to understand HIV as a medical condition and a social issue, and also to reduce your stigma in the counseling environment. Nothing in this module is going to require medical expertise. Everything is framed as a behavioral health and counseling perspective. So let's take our time here because this is where the confusion almost always starts as to what HIV actually is. So it stands for the human immunodeficiency virus. So we're going to break this down word by word here. Human, obviously this is going to affect the virus is affecting humans. Immunodeficiency is where it's weakening the immune system, and the virus is replicating inside of the body. And so HIV is a virus that's going to attack the body's immune system over time. Specifically, it's targeting the CD4 cells, which are playing a central role in coordinating the immune responses. So we want to think of the CD4 cells as the communication system of the immune system. And when the cells are damaged or they're destroyed, then the immune system is going to lose its ability to respond effectively to any threats that happen. So HIV doesn't attack all the cells equally. It's pretty specific, which is why the effects can be really slow and initially invisible. So a person can live with HIV for years without any obvious symptoms, especially in the early stages of it. AIDS stands for Acquired Immunodeficiency Syndrome, and this is not a virus. AIDS is a diagnostic classification that's describing the most advanced stage of HIV infection. So a person is diagnosed with AIDS when their immune system has been severely weakened or when they're developing specific opportunistic infections or conditions. This distinction is critical for counselors. And a lot of people still believe if you have HIV, you automatically have AIDS, and that's just not true. There's modern treatment out here, and there are more people living with HIV that never progress to AIDS at all. And so from a counseling perspective, this distinction is going to help us reduce that catastrophic thinking, reduce some fear-based reactions, and any hopelessness following diagnosis. The language here is going to matter. Using HIV and AIDS interchangeably is going to reinforce stigma and fear. So I want to talk a little bit more in detail about HIV and what it actually does inside of the body. So when HIV enters into your bloodstream, it starts attaching to those CD4 cells. And once it's inside of those cells, the virus uses the cell's own machinery to replicate itself. And so the process produces more of the virus, and it destroys that host CD4 cell, and then it's gradually going to reduce immunocapacity. And without treatment, this process is going to continue slowly over the years of attachment, replication, producing more, and then destroying each one of those CD4 cells. And so as the CD4 cells levels are declining, the immune system becomes a little less coordinated. The infections become harder to fight, and then inflammation is going to increase throughout the body. So you might get some certain pneumonias, fungal infections, cancers that rarely affect people with healthy immune systems. So it's going to be important for us as clinicians to emphasize to the clients that HIV itself doesn't actually cause any immediate illness. The danger comes from the immune system compromise over time. And with antiviral antiretroviral treatment, viral replication can be suppressed, and the CD4 levels will stabilize or they'll start to increase, and the immune system regains function again. And that's why HIV today is considered manageable, not fatal, as it was in the past. So let's get a little bit of historical context here about when HIV first emerged. There were no effective treatments out there. It was kind of a free-for-all, almost a death sentence. People deteriorated quickly. Death was actually really common back when it first came on the scene. But understanding HIV stigma is going to require understanding that history. And the early public message often linked HIV to morality. It was a moral issue. And they blamed specific communities, like the gay community and the African American community. Those particularly predominantly were blamed for the spread. And they failed to respond with urgency because they looked at it as a moral problem. And a lot of clients still carry that emotional and cultural memory from that period, even if they weren't alive at the time. And the fear-based messaging shaped their beliefs of HIV equals death or danger or shame. But medical science has moved forward rapidly. The social attitudes about it didn't. And so as counselors, we want to recognize that this history is allowing us to respond with empathy. We want to avoid minimizing any fear that the client has and understanding any resistance to testing or disclosure. The stigma it's not ignorance. It's a learned fear based on all of this history. And today, HIV is medically understood very differently. With consistent treatment, viral loads become undetectable. And then the transmission risk can be eliminated. And the life expectancy can approach normal. The concept of U equal U is one of the most significant public health advancements related to HIV. Undetectable equals controlled, really. It doesn't really mean cured, it just means it's controlled. But the access to those types of medications and treatments is not equal, which is interesting. And so some of our clients are going to be experiencing substance use disorders and mental health challenges and housing instability and legal involvement. And these are barriers to consistent care. And that makes counseling environments critical spaces for education and support and referral and advocacy. And let's just take a little bit of time here because this is where counselors are going to intervene most often. The clients are going to believe that HIV can be spread through casual contact, which is not true. And they believe that HIV is obvious based on their appearance, which is also not true. It can go undetected for years. And HIV, they have this idea that it only affects certain types of people, but it is a virus, and viruses do not discriminate. And they believe that the treatment is worse than the disease, and that's not true also. And so each of these beliefs increases the fear or the avoidance of testing and stigma towards others and internalized shame. So correcting misinformation should never sound like a correction. It should sound like, you know what, a lot of people were taught that, and here's what we know. Your tone is going to matter as much as your facts do. So you're not expected to be a medical expert here, but you are expected to provide accurate information to your clients and reduce stigma in your setting. And you're expected to encourage health-seeking behaviors and know when to refer someone else. So a helpful phrase to remember here is you don't need to know everything, but you do need to know what to do next. So normalize the conversation, educate with facts, and refer appropriately. So just take a few moments to reflect. What messages about HIV did you internalize when you were growing up? And how might those messages show up unconsciously in how you're working with your clients? And how can accurate information reduce your fear in clients? This awareness is going to strengthen your ethical practice. In the next module, we're going to move into HIV transmission and risk factors, specifically within substance-using populations, and we're going to use some real-world counseling scenarios. So when you're ready, proceed to Module 3.